Whenever you're ready.
I'm ready now. Hi, I'm Larry Martell, and today is day 20. That means I've been 20 days since my bone marrow transplant, which occurred at Stanford Hospital and Clinics in Palo Alto, California. There's many different aspects of a bone marrow transplant, but the part I want to show you today is probably the most important part that you'll play in your pre-op or your pre-bone marrow transplant and also your post-bone marrow transplant time. So, and that's the how to deal with the Hickman catheter that you're probably going to receive when you go in to have your bone marrow transplant. So I'm going to take off my shirt so you can see this. And first let's examine for a minute the actual catheter. If you look, let me get a pen here so I can point to things. If you look right here, this is the incision point of the catheter. This is where it goes in through under your skin, and then there's a line. You'll see there's a line coming up through my neck, which is just under the skin, the layer beneath the skin, and then it goes into a vein in the neck, and then the tube continues down inside that vein down towards your heart, so that when they give you different things, your chemo, your cells back, when they give you your any of your IV fluids, those fluids get into your heart very quickly and then dissipated throughout your body as quickly as possible. It's much better than using a vein in your arm or two veins in your arm in order to take care of this process. So if you have an option of getting the Hickman, definitely do this. It'll be really easy for you. Now, it looks very strange, and it looks like, oh, you know, how could I possibly live with this thing? I've had this thing for 3 months. I sleep with it. I don't even wear a shirt in bed. It's very comfortable. I've never had an issue with it whatsoever. So there are a couple things about care of it that are very important for you to know. And the one I want to show you today first is preparing it to take a shower so that you can keep the bandage, which you can see here is the white thing. Notice this is a clear area here. This clear area is so that you can see if there's any swelling or any redness around the incision point, because you don't want to get any infections. That's one of the reasons you want to cover this before you take a shower each day, to keep it so that it stays dry and as dry as possible. Now, I'm going to say a couple things about keeping this dry. When you take a shower, some days the tape's going to come loose for whatever reason and you're going to get some water on it. Don't panic. It happens. Just dry it off and it'll dry and it'll be fine over a few minutes of time. If it starts to come loose, you're going to have a caregiver. Mine is here today. She's going to be demonstrating some of the parts of this, of the Hickman. That's my wife, Bobby. You can replace this. Just takes a few minutes to do. You'll be trained how to replace this bandage when you get the catheter, or actually before. So, as you can see, we've got the incision point. There's a clear plastic tube that comes down. Then there's a T-shaped piece right here. You can see part of it because part of it's covered up with the bandage. But it then splits into two pieces. Below that, we have two shut-off valves. These basically are just crimp valves. They crimp the tubing so nothing can flow in or out. Below that, we have, you see, one purple and one red connector. These connectors are different colors because you want to be able to tell which one that you've primed, which one you haven't primed, so you're not confused if you drop them down and they were both the same color. It would be very difficult to figure out which one you had just flushed, or which one you had just changed the valve on, and which one you needed to change. Below that, you'll see two blue valves. These are check valves. These will allow fluids to go into your line, but they will not allow fluids to come back out of your line. And then you notice there's a green cap on each one, and in a minute I'm going to take these caps off. But these are caps that are very sterile, and they allow you to keep the open end of these check valves totally sanitary. So now, to begin the process of covering yourself for a shower, you're going to need a few things. I recommend using a quart size storage bag, a Ziploc. The reason I've tried various things. Sheets of plastic, plastic wrap, sandwich bags, and this is definitely the item that works the best. I've tried sandwich bags. The problem is they're not quite big enough, and you'll see when we get into the process why this particular bag will work out the best. You'll also need some tape. This tape will be used to hold the bag in place while you're taking a shower. I recommend this right here. I'm not plugging any particular product, but this NextCare tape, which is available at most pharmacies and grocery stores that have pharmacies, is a really good way to go. It holds up really well, and it's got the advantage that it's not so sticky that it actually hurts your skin when you pull it off after your shower. There's another tape that works as well. It's a blue tape, blue surgical tape. The trouble with this tape, although it sticks very, very well and holds up in a shower extremely well, when you take it off of your skin, if your skin's very sensitive, it might irritate it and it might also hurt a little bit. So that's why I recommend this NextCare tape. The other things you're going to need today, you're going to need a couple of the caps for the ends of your catheter, and I'll show you why about that in a few minutes. Also, you'll need a couple of sanitary gauze pads so that you can clean the end of your catheters before you put the cap on. And you're going to need 2 syringes. These are syringes that contain heparin, but they also contain just saline solution, which basically fuels your entire body. So let's begin by putting the bag on. So the reason, I don't know if I mentioned this, but you need a pair of scissors as well because you're going to cut the bottom of the bag. So what I do is I put the bag up against the bandage to see where the line from the catheter will go when I make the cut, and I want to make sure that the plastic extends past the edge of the bandage. So once you do this 3 or 4 times, you're just going to do it. You won't have to do this measuring, but I'm doing it for you so that you know how I got to this point. So basically, I put my finger there, and then I'm going to fold the bag over. Once I have folded the bag over, I'm going to take the scissors, and I'm just going to make a cut. I don't know if you can see that or not, but basically, I'm going to come down about 1/8 or 3/16, and I'm going to cut over about 1/2 inch. Let me do this again a minute so I don't screw it up. Okay, so there's my cut. So now when I open that up, you see it's about, I don't know if you can see that little, but it's about 1 inch long. Okay, once I've done that, then I take the ends, the caps off the ends of my catheter. You want to throw those away. Don't use them again. Then I place the ends of the catheter into the bag, and I basically just kind of jiggle it around until I finally get the thing in all the way. Now my lovely wife's going to come over, and she's going to tape the bottom of the bag, excuse me, the bottom of the bag, which actually is now the top because I've got it at the top. She's going to now tape across the bag. I'm going to be coughing right now, do I? It's important to put 2 pieces of tape on the bag, and that will keep it, number one, from getting water inside, and secondly, excuse me while I cough, it will also help you, it'll also keep the tape from coming loose while you're taking a shower. Hold on 1 second, I've got to blow my nose. Sorry about this, but I don't have any choice.
All part of the healing after a bone marrow transplant.
Okay, so now I've got the bottom of the bag adhered onto my chest. Now I'm going to fold the catheter lines up a little bit, and then I'm going to fold the bag up and bring that up above the bandage. If you notice that, you can see it. I brought the plastic bag up above the bandage. Now Bobby's going to put 2 more pieces of tape, again, to secure and keep the bag from falling off or coming off during the shower. Okay, so now we've taped the top and the bottom. We're now going to run tape right here along the side. Again, I recommend 2 pieces of tape. Okay, so there we are. We're all ready for our shower. There's no need to tape this edge, and there's no need to tape the bottom. You can do it, but all that's going to happen is, as soon as you start to wash up or whatever, the tape is going to rip loose somewhere. The place that you don't want it to rip is over here on the right side by your armpit or along the top. So just let it run free, it's fine. You can see that the bandage is well protected. There's several inches of plastic covering it. So now you go in and you take a shower. When you come out, the next thing you want to do is take the bag off. Dry your head, dry your neck, dry your upper back, dry your arms, dry your armpits, and then it's time for you to pull this off. So what you're going to do when you do that is, you're going to, and I usually look in the mirror when I do this, but you're going to pull this off, and then you want to just, as you get over to where the bandage is, you just want to make sure that you're not pulling the bandage off as you go. So just pull it down, let it drop down. You come over here, and always go from the center of your chest across. Don't pull it this way, because you probably will have a greater chance of yanking the bandage loose. And secondly, you've only got about 1.5 inches or 2 inches between the edge of the bag and your catheter. So that's not going to loosen enough where you can actually slide the bag off the catheter. So bring this over. Again, use your finger to hold the bandage in place. And then when you get to the catheter, just go along the top of that tape, pull it loose till it's completely free, and then just, oops, got a little bit of a problem here, no big deal. And then just pull it loose, and that's it. Use the bag one time, and then throw it away. Yes, the bag is usable again and again, but the problem is if you get any bacteria in the bag, and then it gets on your catheter, it could be a problem for you later on. So don't try to save 2 cents, just throw the bag away and get a fresh one for the next day. Okay, now, you're at this point, you're dried off, you have to, each day, flush the catheter with your saline and heparin solution. So now Bobby's going to show you how we do that. I'll talk you through it as she goes through the steps. So she always starts with the red connector. So that way, you always want to start with the same color every day, so you never have to wonder, oh my gosh, which one did I go with today? Always use the same color. If you decide to use purple because it's your favorite, use purple. We go with red because it just, as you can see, it's more distinctive than anything else that's out there. Everything else tends to be on the purple side. So she's now cleaned the end. She's now clearing the air that might be in the syringe. Notice what she's going to do next. She's going to pull the syringe back a bit to loosen it, because they tend to stick, and then she's going to push some of the fluid through the syringe so there's no air left in it. Okay, now she screws the end of the syringe on to the end of the check valve, and then my job is to open up the clamp, and then she just pushes the fluid through. Once she does that, she's going to remove the syringe. At any point when she's done, you can go ahead and clamp the tube, and then she takes a clean, brand new cap, and she caps that line on the catheter. She's now going to repeat that with the second line. when you first start doing this, it's kind of scary because you know you don't have any, for the most part, most of you aren't going to have any experience in dealing with fluids that are going into your body, but you can't really feel this at all. Okay, I'm unclamping the line. She's now done flushing my line. The purpose of this, the flushing, is to keep any blood from clotting in the line. And so if you had a blood clot in there, you wouldn't be able to push the fluid through. You'd end up having to go back to the doctor, and they'd have to, I don't know whether they have to replace the catheter or whether there's something they can do to actually clean out that area. Maybe they can pull the clot down through the tubing using some sort of vacuum syringe. So anyway, that's basically it. You're now ready for the day. I hope each of you has a successful bone marrow transplant. I just want to say that mine was amazing. I spent 3 weeks in the hospital surrounded by wonderful, beautiful people, and I wish the same for you. Thank you very much.